Now our next speaker is I think is George. Yep. I don't have my pages here, but don't worry. So it's George Valergakis from the University of Thessaloniki in Greece, and George is going to talk about, is subclinical hypocalcemia a truly subclinical disorder? Thanks, George.
Okay, fine. Good morning, everybody. This is a catchy title, isn't it? Well, I'm sure you're all familiar with this graph. Hypocalcemia stands at the top of the disease cascade of postpartum dairy cows, and with effective transition cow management, we have managed to reduce its incidence to less than 5 or 3%. However, as you've already heard earlier this morning, subclinical hypocalcemia is still a considerable problem. Up to 25% of first calf cows and up to 50% of older ones may have low serum calcium concentrations immediately after calving. Until recently, we only speculated about the association of subclinical hypocalcemia with those diseases. Now, new research is popping up. We had some earlier this morning, and we have our own results also. You can find them, at the poster session. It's 2 rooms away from here, phenotypic correlations of subclinical hypocalcemia with postpartum disorders. Well, we must obviously do something about subclinical hypocalcemia, and if management is not enough, genetics may give us an answer. Actually, this was the main focus of our initial research, and this is going to be presented on Thursday at 3 o'clock, and for more details, please refer to this month's issue of Journal of Dairy Science. Okay, subclinical hypocalcemia presents no symptoms related to calcium concentration. What can we do about it? There is no cow-side diagnostic test, and if we collect milk samples, we have to send them to the lab, and this is time-consuming and this is expensive. If there is one good thing with genetic studies, is that you need a lot of phenotypes. In this case, serum calcium concentrations. And with a little extra effort, you can have more phenotypes. All cows included in our genetic study were clinically examined, and data was recorded. And at some point, we came up with the idea to combine all this data and see if we can find an association between these clinical findings and subclinical hypocalcemia. 770 Holstein cows from 8 herds in northern Greece were enrolled in this analysis. Cows were clinically examined and blood sampled on day 1 and 2. Actually, we have blood sampling on days 4 and 8, and this is going to prove rather useful later on. Just be a little patient. Serum concentrations of calcium was determined by AAS, which is the golden standard, and health was monitored throughout the first 8 days post-calving, and I excluded cows that presented metritis, mastitis, ketosis, and LDA from further analysis. The final data set included 420 complete cow records on day 1 and 427 for day 2, and findings potentially associated with subclinical hypocalcemia was a rectal temperature of less than 38.5 degrees Celsius, more than 100 beats and more than 100 breaths per minute for heart rate and respiratory rate, respectively, 1 or 2 rumen contractions per 2 minutes, and a rumen score of 1 or 2 on a 5-point scale, where 1 means an empty rumen and 5 means a well-filled one. We also considered 3 serum calcium concentration thresholds, very similar to what we have seen earlier today, 8.3, 8, and 7.5 milligrams per deciliter. And all those clinical findings were examined singly, as pairs, with 1 or 2 being present, all 3 with 1 or 2 being present, all 4, all 5 with more, or 2 or more, or 3 or more. For all those combinations, we calculated sensitivity, specificity, positive and negative predicted values, and of course, confidence intervals. As you can see, depending on threshold, subclinical hypocalcemia prevalence was from 13 to almost 37% on day 1 and day 2, and sensitivity and specificity values were very similar across these thresholds. Generally, we either had a low sensitivity and a high specificity, a high sensitivity and a low specificity, or both were moderate around 0.45 to 0.55. Mean specificity values were quite high, but those of sensitivity were quite low. But actually, this was the result of single clinical findings. The best sensitivity we got was a combination of Rumen score with rectal temperature, especially heart rate and respiratory rate, ranging from 0.81 to 0.82, with a nice narrow confidence interval, but unfortunately positive predicted values were low, so was specificity in this case. The best specificity results were more than 0.9 with nice confidence intervals, and sometimes not so nice, but other times a very good negative predicted value when we combined Rumen contractions with heart rate, respiratory rate, and in some cases, rectal temperature. Okay, these are the mean positive and negative predicted values of our tests. They were low for the positive ones, and they were moderate to high for the negative ones. The best positive predicted value we got was 0.67 for these 3 combinations that you can see over there. Negative predicted values at the same time were acceptable, but confidence intervals were very wide, especially even for the best one when we combined Rumen contractions with heart rate. So, what do we really want to do with subclinical hypocalcemia? Do we want to identify problem cows and treat them? Do we want to rule out a herd problem? Well, depending on what our goal is, we can choose our means. Of course, we must also try to find out what the acceptable level of subclinical hypocalcemia is on our herds. I like to be proactive and answer some of your questions right now. No, there was no difference based on parity. What you saw was the same for first and later parity cows. Was I right to exclude cows with health disorders? When I included them back, negative and positive predicted values improved, and so did confidence intervals. Do I have to take out cows with retained placenta from this analysis? When I diagnose a cow with metritis on day 4, on day 8, do I have to exclude her from trying to find out if she has subclinical hypocalcemia on day 1 or 2? What do you think? Did I use correctly the Rumen traits? Maybe if I combine them in some way, I can get better results. Is a rumen with no contractions, but which is full, the same with a rumen with no contractions with an empty one? I'm not sure. I'll find out. Well, I want to be honest with you. During the last 2 months, in-depth analysis of our database made me reconsider this whole issue. Do we really know what subclinical hypocalcemia is? As I mentioned earlier, we also have results from day 4 and day 8. We had to do that for the genetic study, repeated measurements for random regression models. What did we find? Okay, there are some cows that are hypocalcemic on day 1 only. And then there are some cows that have low calcium serum concentrations on day 1 and 2 only. And then there are some cows that are perfectly healthy on day 1, but are hypocalcemic on day 3. And in all of these cases, they return to normal by day 4 and relapse by day 8. And again, there are some cows that have low calcium concentrations on day 1 and 2, and they are still hypocalcemic on day 4, or they are hypocalcemic for the first time on day 4. And there are also some cows that do the same thing on day 8. Do we really know what subclinical hypocalcemia is? Any case, to sum it up, the take-home message is that some certain clinical findings, including heart rate and rumen traits, may be indicative of subclinical hypocalcemia on day 1 and day 2 postpartum, but I think that for the time being, practical application cow-side is limited. We need more research. And of course, there are many, many interesting things to learn about subclinical hypocalcemia in the future. Thank you for attending.
Again, another very, very interesting talk on a very, very important topic of hypocalcemia. If anybody has a question, again, just raise your hand and we'll get a microphone over to you. So, George, do you think yourself you'll use the actual metabolic diseases themselves, like mastitis, metritis, and this base alveolus? Do you think that would be a better monitor of a risk of hypocalcemia in a herd?
Yes, I think we should use them. The problem is heart rate. We know that heart rate is elevated when we have metritis. Mm-hmm. But we diagnose usually metritis after day 2, on day 4, on day 8, on day 10. So if I include these cows with their elevated heart rate on day 1, is it because of metritis later on, or maybe metritis is because they have hypocalcemia, which is for which I have a sign on day 1, and then I get metritis? Mm-hmm. I mean,
and have you any theories on the relapsing at day 8?
Yes, we do have, because we also have measurements of phosphorus, magnesium, and potassium concentrations on the same day, on the same days, sorry. We have found some associations. We're not ready yet to show that. We're working on this paper. Probably by the end of the year, you will see it published somewhere. So, okay. Anyone else?
Excellent. There's a question here at the front.
My name is Josh from Melbourne.
There's a microphone beside you there.
Okay, Josh.
My name is Josh from Melbourne. My question is based on the genetic direction. Which direction do you think are you going to head, using genetic parameters or estimated breeding values?
Okay, for now we have published heritabilities for those traits. For concentrations, serum concentrations, and we're about to publish them for subclinical diseases as well. So this is the first step. It's the first time that genetics are in association with subclinical or clinical, for subclinical hypocalcemia. So hopefully in the future we can select even for hypocalcemia, why not? Against for, I mean, sorry. I think this is just starting to come up. Breeding values will be the final result of this effort.
That's perfect.
I have one more question.
Okay, one question, just about time. So one question over here.
Yep.
Chababachi from Hanover, Germany. I would like to ask you if you have standardized your blood sampling in terms of calcium, if you consider the milking time and the feeding time when taking the samples from your cows.
Yes, they were collected at the same, almost the same time every day regarding milking and feeding. It was immediately after morning milking and feeding, at least 95% of them.
So could you all thank George very, very much again for a good talk. Thanks very much.